Good morning, viewers, and again, we are joined in by Dr. Paul Chivenge, and we want to continue our discussion on infertility amongst women. Thank you so much for all the comments you put on our last presentation where we're talking about sperm quality versus quantity, all the insightful suggestions and the discussion we had. So today we want to continue on the same discussion. Like I said, when we talk about infertility, is not a case of pointing fingers to either women or men, but rather a joint discussion that we should have. Dr. Paul, good afternoon.
Good afternoon, Richard. Good afternoon, viewers. Yes.
Um, yes, Dr. Paul, what exactly is infertility in women, and when should a woman start getting concerned about her fertility?
Okay. Yeah. Infertility per se, like we said in the previous uh, presentation, is a condition. It was diagnosed now. I mean, it was categorized as in a state of a disease that a person will fail to conceive for a period of 1 year. Okay, when they are actively involved in sex with their partners. And I emphasize this is a sexual partnership between male and female, yeah, for a proper definition, for a period of a year, okay, without conception. And I have to say that in women above 35 years, we define this in 6 months, okay? Because already 35 years is the cutoff time where you have chances of 50-50 chances of a woman getting pregnant. So when you go above 35, it means that your chances are even narrower. So a woman who is over 35 years, we don't give her that leeway of 1 year. We assess her over 6 months. I hope we get that right. So that's what we call infertility. And in it, there is primary infertility for a woman who we are gynecologically categorized as para 0+0, meaning that she has never conceived or lost a pregnancy. So that is a woman who is primarily infertile. Then there is a woman who has probably conceived before and maybe lost a pregnancy or lost a baby, who they will write in gynecology as para 0+1, based on how many times she lost. She can be para 0+2, para 0+5, yeah, like those who have had frequent miscarriages. So those are also counted, okay, as efforts towards getting pregnant. And then that will what we call secondary infertility. Then the third category is the one which is where the cause of infertility cannot be told, cannot be known. And that's what we call unexplained infertility. So that is also another category of its own. That we have investigated the male, we have investigated the female, but we cannot find why they have failed to produce. Yeah, and many times you go to these healthcare providers and they tell you that no, we have seen that everything for you is normal. Yeah, so sometimes they fail to find. Yeah, and we say that the causes are 30% from the male and 30% from the female. Then that is 60. Then 20% can be from both male and female. And the other 20% that remained is the unknown. Yeah, but we believe, don't think so much about the 20%. Don't go straight away and say, I think my infertility is already an unknown form of infertility. Yeah, because by 80%, we are able to tell why a couple is not able to produce. I'm sure even if it's an exam, you cannot say that a person got 80 but they failed. You know? Yeah, at least we know optimally that they could have what? You could have known why. Then there's also what we call subfertility and delayed fertility. Subfertility, yes, these are people who are not necessarily infertile, but they are delaying to what? To conceive. Yeah, and that one can also be a period of 6 months for a woman more than 35 years, okay, or a period of 1 year for a woman who is less than 35. Yeah, she has delayed, but she's fertile. Then, I mean, that is subfertility. Then, delayed is when you delay to conceive after the age of 35. And those are also many. So, those are the different grades or forms of infertility in women.
Doctor, actually,
Mm,
that is very right because in my practice as a sonographer before I did the nuclear medicine, that used to be
mm,
one of the disturbing thing. A lady comes with either
mm,
primary or secondary infertility, then you do all the
mm.
examination, you do HSG, you do
Yes,
ultrasound scan, transvaginal scans of the uterus, and everything is fine, but they cannot.
yes,
They
yes.
claim they cannot conceive, and the husband keeps having children
Mm.
with other women,
With other people,
other
yes.
men. So,
Mm,
doctor, as a clinical embryologist, what are some of the most common causes of infertility
mm.
amongst women today?
Yes, infertility starting from endocrine causes, yeah, and hormones. Yeah, we discussed about the hypothalamo pituitary axis in the previous presentation. The hormones that a woman have can have a hormonal imbalance, for example. That is right from GnRH, gonadotropin releasing hormone, okay, then to the other hormones like follicle stimulating hormone, luteinizing hormone, and estrogen, prolactin. All those hormonal causes, they have reference ranges, which I will not go into now, but they can cause a woman to fail to conceive. You remember, it's the hormones that regulate the menstrual cycle. So if they are not normal in levels, they can also end up not just dysregulating the cycle, but also to cause infertility. Okay. Then, as we progress, you know that the sperms are deposited in the vagina, and from there they move to the what? To the uterus, and from the uterus they are screened to go through the fallopian tubes, and then from the fallopian tubes at the distal third of the fallopian tube. That's where they have the region called the ampulla region. That's where the fertilization takes place. So it's a whole journey that sperms move naturally. But just know that 85% of pregnancy occurs naturally, but 15% is what we are doing by IVF. Why do we do IVF? No, not by artificial assisted reproductive technology, which we call ART, not not the art that you know about the HIV drugs, but we have what we call assisted reproductive technology. So once the sperms are not able to travel that journey properly, that's where we end up. Apart from the hormonal levels, that's where we end up. The 15% of people who cannot produce naturally are the ones that we take for art, for assisted reproductive technology. But that is according to the anatomy of the body of the woman. Yes, if there is therefore any problem, yeah, you are flying from London to New York. If there is a problem with the clouds in the air, if there is a problem at the airport where you are living, if there is a problem at the airport where you're landing, you will not be able to land. Okay? So that is the same thing with fertilization. Along that journey, if there is a problem with the sperms progressing its journey towards the egg, either inside the uterus or in the fallopian tubes or with the ovaries themselves, fertilization will not take place. So those are the many of the causes that will cause infertility. Of course, age cuts across in all women and men. Yeah, there's a limit of age especially in women, that can hamper them from becoming infertile. I told you your cutoff level is at age of 35. That's where you have a chance of 50-50 conceiving. So you can find that the uterus maybe has adhesions. Yeah, there's what we call Asherman syndrome. People who have had recurrent miscarriages and abortions, and they have gone to theater, what they call they are cleansing the uterus after a pregnancy loss. You can find they have fibroids, which also come with age. Yeah, for an idle uterus that has been idle for many years, and these days, we used to expect them mainly in Catholic nuns who don't produce, or a person who has few or less children, such that many of the times the uterus is idle. Okay, but it has gone, fibroids have gone to a level of a lady as young as 24 years. Yes, so it is no longer an issue of women who are older in age or who have not produced. So those ones can also be a problem once they are there in the uterus, and they are what we call polyps. Polyps, more like just a simple flesh that will start growing, an outgrowth inside the what inside the uterus. That one can also cause infertility. Then, when you go to the tubes where the sperms are going to progress from, where they are going to pass, it is believed that over 50% of infertility in women is due to tubal factors. So, once those tubes are blocked, either in part or in totality, or in any way, one could be open, the other one is blocked. A woman who has had an ectopic pregnancy or a surgery and one tube has been cut, you know, that one can cause infertility. Then, once you are done with the tubes, some of them are even anatomically exist when they are not, they don't have a good shape. They are coiled or they are tortuous. Even the uterus has abnormal shapes. You can find a uterus with two fingers, in shape. You can find a uterus with a single finger, you know. You can find a uterus that has been blocked totally, you know. Yeah, naturally. All those categories of uterine abnormalities or vaginal abnormalities can also cause infertility. Then, when you reach the egg, the ovaries themselves, you've heard about what they call PCOS, polycystic ovarian syndrome. Those ones can also cause infertility or ovarian insufficiency. You've seen a woman who has irregular periods. In both cases, you'll have irregular periods. Sometimes the periods don't come. Sometimes they come when they are very heavy, simply because of PCOS or ovarian insufficiency. So those are a few of the reasons that can cause a woman not to produce. Yes.
Thank you so much, Doctor, for that explanation.
Mm, mm,
I was reading somewhere and they say the trend of
mm,
infertility in women seems to be slightly
mm,
rising globally
mm.
compared to the way it was maybe 20 or 30 years back. What could be the reason that or today the
Mm.
trends of infertility seem to be on the rise?
Why
Why do we?
infertility is going up in women?
Yes, what? Yes,
And I
today.
said we start from the causes,
Yes.
tubal causes,
Mm.
blockage of the fallopian tubes. That is frequent now. Many of them, you know, I mean, there must be also a rising trend of people who are getting, mainly sometimes people get infections, okay, from areas of convenience, yeah, sexually transmitted disease conditions, yeah, infection that ascend from the lower part of the female reproductive part that go up will eventually end up affecting and blocking the fallopian tubes. Yeah, then lifestyle changes that have come up. Yeah, there's a trend. You will also notice a trend of in diseases which are non-communicable diseases, uh, hypertension, diabetes, per se. Yeah, they are also growing. Okay. Yeah, those are cases we never used to worry so much about in Africa, especially. Our problems were mainly with infectious diseases, but now those ones are also growing in trend. Yeah, but and also since we said that age per se is a very big reason in the cause of infertility in both men and women. In women, it is worse because of what we are trying that climb that ladder of female emancipation, of career achievement. Eh? Yes, in Uganda, for example, where I am, okay, we start school sometimes when we are past age, okay, and then when you are going to school, you get roadblocks and hitchhikes in the way. Hmm? Yes, you find at a certain point you are supposed to repeat a classroom. Or even at university, a person might repeat a year. But I'm just saying that they are spending so much time in school. So when you finish a certificate course, for example, that's the earliest qualification you have. You are going to say, I think now from this certificate, I want to do my diploma. You are going to go and do a diploma. And then your parents are advising you. Once you are in school and you become pregnant, you are going to be disorganized. You are not going to be able to raise up a child and also go to school at the same time. And for us, we want you to go and marry uh, when the unofficial husband shows up. Okay? We want you to go officially into your marriage. So you are trying to achieve your career. You are looking for Mr. Right. Okay? Yeah. And then as you progress, after that diploma is done, you say, I think most people these days to get a job, you must have a degree. Hmm? I'm talking about people who have gone through projectile education. Yeah. Not saying a person went through O level, A level, university, 1, 2, 3 years and done. That is a direct entrance student. Yeah. But the people who are trying to balance out huh, going to school and what is in life. So after the diploma, you enroll for a master's degree, for a bachelor's degree. You do the bachelor's degree. After the bachelor's degree, that you find that no, I think the job market needs someone with a what? With a master's. Hmm? You go for a master's. You are still a woman. You are the same woman, and then from there you even think about a PhD. Okay. Maybe even by the time you finish, even at bachelor's level, you get this job in an organization that tells you, yes, we have a contract for you for 2 years, but it doesn't have maternity leave in it. So you sign up because you are desperate for a job. Then you say, what am I going to do? I can't miss a job. This is a TV presentation show that I'm going to do. I'm not going to be presenting to the public when I'm pregnant, for example. I'm just giving an example. But there are many companies, organizations that don't encourage women to produce during their continue of work. So by the time you finish all these things, remember the eggs, you lose 1 or 2 every month. The levels go down and their quality go down. Yeah. So all these are factors that are increasing infertility in women per se. Yes. So the infections that affect the fallopian tubes,
Mm,
especially what they call pelvic inflammatory disease, you find
mm,
a woman that gets a lot of menstrual pain, when they are in their menses,
mm,
endometriosis, one of the
mm,
reasons, and so many other conditions that have been on the rise. But I'm
mm.
just telling you that those are some of the reasons that women take time to produce, and that is causing infertility to go up in women. Yes.
Uh, Doctor, talking about some of the medical and scientific insights, Can you help us also understand how age affects a woman's fertility, especially in relationship to egg quality and quantity?
Yeah, I think all women and men they know the word menopause. Okay, yeah,
Yes.
meaning that the menstruations will pause. Okay,
Mm.
they will no longer have periods again,
Mm.
and that one starts regularly at the age of 45,
Mm.
going up. Yeah, it can go up to 55. So the average in between becomes 51.
Mm.
Okay, so we said that by 35 years, the chances
Mm.
of fertility are 50-50.
Mm.
Okay, so as the ages continue growing, and
Mm.
remember, this is not being biased over women, they are known not to reveal their correct age. Okay, especially in our country.
Mm.
Yeah,
Mm.
that can even cut across their passports, they even cut across their national IDs,
Yeah.
or
Mm.
even a woman who is just dating a man for a drink on one
Exactly.
evening, they will not
Exactly.
tell them their right age.
Mm.
So you are going to hide your mathematical age, but your
Mm.
biological age is constant.
Mm.
Okay. So when the more they keep growing past the
Mm.
35-year cut-off point, is
Mm.
the lesser their chances of fertility. The number, the quality of their eggs go down. Okay,
Mm.
with many factors. But I have to tell you honestly that I've seen a lady at 32, even 30, who
Mm.
has already entered menopause. Yeah, there are many factors that are coming up, including the diet, in the environment we are living in. You
Mm.
know, you can talk about anything, including the weather patterns that are changing in every
Mm.
country.
Mm.
Okay, there's a heat wave coming, so we don't know what all these factors are affecting in our reproductive cycle. Not so
Mm.
much research has been done, but just to know that they are happening. Their
Mm.
toxicity in our environment is also there, has gone up. So you find yourself that yes, at the end of the day, yeah, menopause is coming earlier, but just
Mm.
know that before you, I mean, by the time you move, by age
Mm.
of 45, anytime from then, your eggs will stop. Okay. The cycle might continue, the menstrual cycles might continue. You might see blood every month, but the eggs are not there anymore. And the
Mm.
scan will be able to show you that. Yeah, so that's where their disadvantage comes from. As
Mm.
opposed to men, yeah, I told you in the man's video we had that there is a man who has been able to produce at the age of 90 to have a
Mm.
child. Yeah,
Mm.
this gentleman was from Zambia and had lived for years and failed to have a child. But he ended up getting one. He died of during COVID time. He was a patient of Dr. Sal. He died
Mm.
of during
Mm.
COVID, but he was able to see his child in the lifetime. Yeah,
Mm.
so in women, the biological clock kicks in, and the eggs, even if they are still there, the quality would be bad. We have seen women producing children,
Mm.
or couples, I will not say only women, having children who have
Mm.
diseases like Down syndrome. Mm.
Mm.
You know, those kids with round faces, webbed
Mm.
necks, you know, yeah, more single creases in their palm and rough skin and moonset eyes and no nasal bridge. You know what a Down syndrome child is. Those
Mm.
are all products coming out of poor quality of eggs that has come with age in women. Yes, you will not see a 16-year-old girl produce a child of Down syndrome. It is very rare, or it will not even be there. But you go to women who are above 45, who have
Mm.
children who have Down syndrome, they are going to be very many. So
Mm.
when the age quality goes down and the quantity, definitely, we expect that to happen. Yes.
Wow. Wow. Doctor, again, so many women and people today here of conditions like polycystic ovarian syndrome, PCOS,
Mm.
endometriosis, and the tubal blockage, which you talked about earlier. Can you help us understand these terms, especially PCOS, endometriosis, tubal blockage, and actually how each of them can lead to either permanent or secondary
Mm.
infertility?
Yeah, in endometriosis, you know that the uterus has a specific kind of tissue.
Mm,
Okay. Yes, just like the brain tissue.
mm,
Uh, if they cut any brain, whether it's an animal or a human being, it
mm,
has its own brain cells that are separate and different
mm.
from other cells of the body. Yeah,
Yes.
for example, your brain cells are not going to be the same as the cells on the tongue, mm,
Mm,
or in the intestines. So the uterus also has special cells, especially the myometrium. Okay,
mm,
yeah, which is the muscle
mm,
that forms the uterus, or even the endometrium, the lining.
mm,
So that those cells are supposed to be localized specifically in the uterus, okay,
mm,
or making up the what the component of the uterus. Now,
mm,
whenever you find that part of those tissues are found elsewhere
mm,
outside the body, okay, you
mm,
definitely is what they call endometriosis. They
mm,
have seen these tissues deposited inside the inside the abdomen. You know,
mm,
I think there was even a research of some found going towards part of the brain. Okay, so
mm,
whenever endometriosis occurs, that you have
mm,
uterine tissue deposited anywhere outside the
mm,
uterus, that's when the condition comes. Yeah, it comes with a lot of other symptoms, including very painful menses during the menstrual
mm,
period. Yes, and can also be a cause of infertility. We had a
mm,
very good facility in Uganda by Hendrop for
mm,
late Dr. Spire. He was an expert in endometriosis. Okay. Yeah, but that was mainly, I won't go so much in the details of
mm,
how that will affect the reproduction. But whenever you find endometrial tissue uh, deposited elsewhere outside where it is supposed to belong, that is what how the condition called endometriosis comes up, and it's a major cause of what of infertility. Then, when you talk about polycystic ovarian syndrome, is similar. I mean, you are going to find cysts whenever I'm explaining to ladies, to my patients. This will be more like give imagine a tiny balloon that is going to form inside the ovary. Okay,
mm,
and then you're going to find that so many of them are found inside that ovary or
mm,
even outside. They can be paratubal, meaning that you are
mm,
going to find deposits. Some of them are hemorrhagic, they contain blood. Some of them just contains clear fluid. So
mm,
once that comes up, definitely
mm,
know that it's going to be harder huh, for the sperm to find
mm,
the egg, to get where the eggs are, or even the egg to leave the
mm,
ovary, to move, to migrate. Because I told you, once they migrate from the ovary through the
mm,
fimbriae, finger-like projections, they
mm,
eventually reach the ampulla where they are fertilized. So when these cysts become obstacles,
mm,
not easy to have fertilization take place. Yeah, it will not be possible. So that is what could be roughly the the way you are going to end up with a woman who has polycystic ovarian syndrome, unable to produce. It's very common with women who are obese, for example.
mm, mm,
Yeah, usually when we give them treatment, we also give them medicine to lose weight, which is the same medicine that treats uh, uh, that treats diabetes. So last week, I think this week, on Monday, a lady comes back to me and said, "You gave me medicine to take, but when I reached where I went, they told me that I have diabetes." I told her, "No, that is a drug that does more than one thing. I didn't
mm,
give you for diabetes. I gave you for the cysts that were in your ovaries." Yeah,
mm.
so they are also synonymous with obesity. Yeah,
Okay.
but more so they will cause dysregulation of the menses. Then with the tubes, I've already explained that to you.
Yes.
Yeah.
Doctor, there is also something that I used to hear a lot when I was still operating ultrasound scan. Patients,
Mm,
especially ladies, used to tell me about their, especially clinics, telling them, oh, they are not having children. They are primary or secondary infertility because of candida and other
mm,
fungal infections. Is this true?
mm. Yes, those are infection. I did not categorize which ones
Mm,
will ascend from the vaginal canal into the
yes.
cervix, yeah, and through the uterus. But there is a multiple of them. Yeah?
Mm,
Actually, when you are treating, sometimes it is
mm,
better to give multiple therapy of antibiotics, huh?
mm,
Because they don't move in isolation. It's
mm,
not like you moving alone on a road.
mm,
When they move in convoys. So
mm,
candida is a fungal infection, yeah, and once it affects the vagina,
mm.
mainly, it will also can move and progress all the way up to the what? Up to the fallopian tubes. So it
Mm.
can be one of them. There is no problem about it. And
Oh.
just know also that sometimes when we overuse antibiotics, we will kill the natural flora that is in the vagina. You know, yeah, because our body, like we have staph aureus on the skin, there's no more flora of the vagina which can be destroyed by what? By antibiotics. So I used to see in the US whenever they prescribe a prescription of antibiotics, they used to prescribe an antifungal like fluconazole. Yeah, yeah, that was low, and even the system will generate it because this woman is going to take medicine that's going to destroy normal flora in the vagina, which can be preceded by a fungal infection. Yes, yes.
Okay. Thank you
Mm.
so much. Again, if you're watching us today and you have a question, leave it in the comment section. But also, if you're here for the very first time, I kindly ask you to subscribe and to follow this channel for the rest of this program. Doctor, what are some of the modern treatments that are available today for women struggling to conceive, and how successful are they?
Yeah, that one depends on the cause because
Mm.
you cannot treat unless when you know the cause.
Yes.
That's why I usually tell women that I don't care if you went and met a doctor that did not do investigations. You
Mm.
just explain them that have tried to produce and failed, and then you end up just picking up medicine and go.
Mm.
Your chances of success are what are minimal. So
Mm.
we treat according to the cause.
Mm.
If it is hormones that are imbalanced, put someone on hormonal therapy and
Mm.
then assess later to see if they have come to be balanced.
Mm.
If it is a uterine cause,
Mm.
if there are adhesions, if there are polyps,
Mm.
if there are fibroids, they have to be removed. Huh? It's like you now in that room. If
Mm.
somebody wanted to use that room separately where you are recording from, but you are
Mm.
inside, they will not be able to use it until they
Yes.
tell you that, please, can you walk out? We want to use the room. That's
Mm.
when you created vacant. So
Mm.
that is the same thing with the uterus. Once it's occupied, like a plot, someone built a structure in your plot of land, you cannot
mm,
come and also build another one in the same plot.
mm,
Yes, you have to remove whatever obstacle is there.
mm,
Yeah, the most debatable treatment in management of infertility is what people talk about as tubal flushing. You
mm,
know, the chances of succeeding when those tubes are blocked are very minimal.
mm,
Okay, so that's
mm,
why where I work is that when they find the tubes are blocked,
mm,
they will send you straight to IVF, because
mm,
IVF you will not need. hmm, You will
mm,
not need the tubes anymore.
mm,
Actually, it could even help you to remove them. Hmm.
mm,
Yeah, but you can imagine when people come after infertility, some have been failing for 10 to 20 years, and then you tell them, let's flash the tube and then watch and see for another 1 year. So you have increased that by 11 years or 12 years or
mm,
21 years. Yes. So when it comes for tubal blockage, I
mm,
think the best method of intervention is going straight to IVF.
mm,
Then the other condition, the PCOS, is operatable. Okay,
mm,
not operatable. You get medicine that will do away with those cysts, right
mm,
from contraceptive pills to other supplements and the medicine I told you about that treats diabetes, that
mm,
can treat the PCOS. So
mm.
the intervention is based on the cause. In summary,
Okay.
yes, sir.
Okay. Uh, okay. I think this you've explained. Normally, uh, so many people want to hear about embryo transfer or IVF, but I think
Mm.
you have tried to talk about it. Doctor, there are
Mm.
also a lot of misconception and
Mm.
misinformation around infertility. Some people even call it a curse or a punishment. How do you always respond to this in your clinics?
Uh, these days, by the way, there are many doctors
Mm,
because everyone has a knowledge about something to do with health. Someone
mm,
will tell you do this, another one tell you do that. I follow the same protocol that we are supposed to do. Get the
mm,
history of the patient, examine the patient,
mm,
do investigations, and then you
mm,
treat. Yes, you cannot change so much about people's conceptions.
mm.
Yes, yes, a person will tell you that this woman was cursed by her auntie, and that's why she's not producing.
Yeah.
Another one will tell you that she aborted a child from a clan of a man whose clan they don't abort their children. There are all kinds of misconceptions and myths. But for me, as a doctor, I would follow the normal scientific way of
Mm,
investigating and making a diagnosis of the cause of infertility. Without, I will help them to understand. Yeah, from my perspective.
mm,
Yeah, usually before I do anything, I'll sit down with the patient and explain in depth, why she might not be producing. And you find that by the time you start with the journey with her, you'll
mm,
find that one of the things you have explained to her has been found, or
mm.
she was told somewhere she went before she even came. Yeah, scientifically. Yeah, so that's what I do. Yes.
Doctor, again, can lifestyle such as diet, stress, weight
Mm.
really affect a woman's chance of conceiving?
They do stress, uh, diet. Of course, we talked about lifestyle diseases like
Mm,
diabetes, too much sugar, alcohol per se,
mm,
smoking, caffeine, all those can cause infertility. Okay. So in women, they definitely will. Yeah. Think about a stressed relationship. eh?
mm,
You are married, you have been together 2 3 years, you are not able to produce.
mm,
Okay. Yes. Or you're a woman who is trying to juggle so many things. Okay.
mm,
She's teaching in 3 schools. She has a loans with 2 banks. She's trying to manage the home, eh, by doing everything that she can. Yes, even the body physiologically, you know,
Mm.
it will not respond. Yeah. The simple example, just someone traveling. Yeah, it's a person was living in Uganda, and then
Mm.
finally, yeah, he has got a visa. She has gone, lives in Michigan, finds there a very harsh winter, yeah,
Mm.
or London, and
Mm.
the environment in them has changed. So the
Mm.
body is physiologically stressed. Okay.
Mm.
So that woman, the first thing that will change the order of her menstrual cycle will
Mm.
definitely be altered. So with more stressors on your body, be it male or female, you can still
Mm.
end up being infertile. Yes.
Mm. Doctor, then there is a problem of natural herbalists that always give
Yes.
me headache, especially on social
Yeah.
media today. Recently,
Mm.
there is a lady who I totally know she's into, comedy. She does
Mm.
comedy on social media. Now, last time I switch on my phone, and she's
Mm.
busy calling women that have never had or secondary infertility to
Mm.
go get remedies from her. She has a list of jerry cans she's talking about. Um,
Mm.
I mean, what's the truth about this, and
Mm.
what's your advice to people who are undergoing suffering from infertility but then are being channeled to herbalists?
Mm. I don't want to downplay the role of traditional medication
Yes.
because there are some conditions I've seen
Mm,
which have been used, treated by herbal medications. Yeah, there
mm,
was a herb that was being investigated by AIC, which was
mm,
found, that is AIDS Information Center,
mm,
which was found to treat diarrhea in HIV, even more than the conventional medicines.
mm.
Yes, even the drugs we have, anti-cancers and anti-malarials, are made from herbal medication. If you went to a
Yes.
very good lab, yeah,
Mm,
you'll find them collecting these herbs.
mm.
But there's an element of purifying them and
Yes.
dosing them, yeah, which
Mm,
is not considered in many herbalists.
mm,
So you may not know, yes, yeah, there's a herb you can even use when someone has anemia and the
mm,
blood levels go up. Mhm. So you may not know exactly which particular herb is supposed to be used and
mm,
what the cause of infertility. Yeah, if a person has blocked tubes and you
mm,
give them herb that is going to help hormones to normalize, it's not going to help them, for
mm,
example. Yes, so it all depends on what the cause of the condition and also the components of the herbal treatment. Yeah,
mm,
but in many cases, all this is not investigated. Yeah,
mm,
they'll give you a single herb that treats over 6 diseases. They say
mm,
this is the same herb for appetite, for diarrhea, for
mm,
deworming, and they come up with so many ingredients which you cannot filter out, and in the
mm,
end, you can treat a condition and end up knocking down the liver. Yeah, because detoxification is done in the liver. Whatever
mm,
wastage is brought into the bloodstream will filter down into the liver. So that is why it is not advisable to use
mm,
them unless when you know what they contain, okay, and how much dosing you're supposed to give a person. Okay. Yes.
Okay. Doctor,
Mm.
talking about now, lastly, emotion and social dimensions.
Mm.
How have you been able to? How can couples support each other emotionally when faced with fertility challenges? And how
Oh,
important is this?
yes. Yeah, it is a very difficult situation.
Hmm.
People have come up being nicknamed names
Hmm.
because they have failed to produce.
Hmm.
Relationships have broken up. I've seen a man who told me, "This is my third wife, but the other two that left me went elsewhere and produced, but I'm not able to produce with her." I've seen women who come and cry literally and say, "Doctor, my marriage is breaking up simply
Hmm.
because I can't have a child." You
Hmm.
know? Yeah, there's also a famous lady now. who was giving her story of infertility.
Mm.
She was she adopted over 20 children that she was
Mm.
looking at. But
Mm.
when one of the child was graduating in her speech, she said, eh, and I
Mm.
quote that, yeah, because this is not my real mother, you know.
Mm.
And when she said that, the woman who adopted that child, she became so depressed and affected from that graduation because she said, now, if this one among the other 10, 15, and 20 can make such a speech that I'm not the mother of her, how about how much has they been have they been talking about in the background about me, despite
Mm.
of how much I've helped them, okay, to look after them. So it
Mm.
is a very difficult situation, depressing and mentally. People even end up taking medications simply because
Mm.
they are afraid to produce. And that is the people who have not even sought care. Then
Mm.
those who have sought care and gone for treatment, there is also a part that yes, you might have intervention, you have spent a lot of money financially, and you get disappointed.
Mm.
Yes. Of course, if the results are good, everyone will be happy. The doctor has treated you, and you, the family, will be happy. But when a person
Mm.
has failed to conceive, and after spending a lot of money, and through all the treatment that they go through, lie on this bed, climb this ladder, do this,
Mm.
they really get very depressed. Actually, I would think it's even more depressing than the time they had before trying to conceive. Then
Mm.
after that part, yeah, they need a lot of support. Yes, but it affects your mental capacity a lot when a person tries to conceive and fails. Yeah, it can be a form of illness. I've heard of a woman who said that she tried 3 cycles and failed, but during that time, because it is not going to happen over 1 month,
Mm.
she did all kinds of online courses in order to occupy her mind. Yeah. Finally, at the fourth attempt, she managed to conceive. Yeah, to have a baby. But it can, like I said, it's a source of breakup of so many relationships and marriages. Yeah, and can even cause mental illness permanently. Yes.
Mm.
Yes.
So, doctor, what message would you give to women who feel ashamed or isolated because of infertility?
Yeah, the most important thing, first step, like the men do, is to
Mm.
find out. Yeah, try to visit a fertility specialist and find out what is the cause. Why
Mm.
are you not being able to produce? Other than speculating or
Mm.
suspecting. Yes. So that is number one. Number two, they should not be lied to by menstrual menses. Getting into your
Mm.
menstrual period, even after 45 or 49, you can
Mm.
still have periods, but when you are not fertile, okay, as women.
Mm.
So until you go and get a health analysis of the cause, you cannot come to a conclusion. Yeah, like
Mm.
I said, in men that having a good body physique of a man does not
Mm.
mean that that man is fertile. Yeah, so it's the
Mm.
same thing with women. Yeah, you always have to find out what the cause is. And from there, you can decide and say, this is something treatable, I can afford. Sometimes it's just frequency of the sex that you're having. And sometimes it's something not to do with the woman, but with the
Mm.
man, which they are trying to run away from. You're trying to think that that men cannot be fertile, which is a very
Mm.
bad myth. Yes.
Uh, in your experience, doctor, how can families and partners become more supportive and understanding in this journey?
Mm. Yeah, they have to come to the same understanding because
Mm.
if you are looking for a solution to a problem, you have
Mm.
to understand what the problem is. Yeah, and then they have to walk the journey together. Mm.
Mm.
If it is a couple saying that for me, I have my 2 children from my ex. Mm.
Mm.
If this man cannot produce, I'm okay. I'll raise
mm,
them. Or if it's a man saying that, no, my other two late women have their children. If this woman cannot produce, shauri
mm,
yake. Yeah, it becomes very, very difficult. And I've seen
mm,
people, you give results. A man's results are bad, the woman's results are okay. But
mm.
before they even leave the room, you find that
They are
uh,
separating.
they are separated
Yeah.
psychologically and physically. You know
Mm,
that this relationship is not going to last. So sometimes we also even limit. When we see the results are very bad, we don't share them, you know, with both people at the same time, whether they came
mm,
together in the first time or not. Yeah, I will try to talk to the person who owns them and tell them, yeah, this is the problem you have, and the solution is one, two, three. But I do not want your husband to hear what I'm going to tell you. Oh, I do not want your wife. Yeah, I find a way to get one of them out if I know that what I'm going to tell them, yeah, is not compatible to both of them. And then later, I'll call the second person that I get out, and then I look for a story to tell them. Yeah, yeah. But if the results are so bad, yeah, I always share them with the owner first. Yeah. Otherwise, yeah, you might find that yes, you are telling them the truth, but one of them is not ready to take it. And
mm,
in that case, usually men will always walk away when a woman has a problem. More like HIV diagnosis. A man finds out a woman is positive, chances are high he's not going to keep to that woman. So is infertility. But when a woman find out the man is not fertile, sometimes they hang in there. They will say, but this is the man that my family knows. Now, who am I
mm.
going to start a new relationship with? They usually have many questions, and sometimes they end up sticking into the relationship.
Okay, doctor, as we conclude, what are some of the newest scientific breakthrough thinking
Mm,
about hope for the future in
mm,
fertility medicine that will most
mm.
likely give hope to the women today?
Uh, we started with timeless sexual intercourse for a
Mm,
person who is not uh, permanently with their man. A
mm,
man is a long distance truck driver or who travels a lot. And sometimes by the time he comes home, yeah, the woman is not ovulating, you know. So you start with dealing with them to monitor their cycle and make
mm,
sure that they can have intercourse during the time the woman can produce. The second intervention,
mm,
if the woman has no issues,
mm,
you go to intrauterine insemination,
mm,
which is more like artificial fertilization they use in animals.
mm,
You take the good sperms that are purified and then you deposit them into a woman that has been prepared. Okay?
mm,
Sorry. And that is when the tubes are open and the sperm have good concentration, she will
mm,
produce. Then the third, you go to if the woman's uterus or body
mm,
cannot be used, they are surrogate mothers.
mm,
Yes, that you can get her real eggs, you can get her husband's sperms, put them together, get embryos, hire a woman to carry that pregnancy for them. Okay.
mm,
Then you can talk about in vitro fertilization, where
mm,
you pick the egg, the sperm, put them together, fertilized, then you put them in the uterus, and then they grow. Then you talk about intracytoplasmic sperm injection,
mm,
ICSI, where they pick a sperm mainly for infertility in men. Maybe the sperm has a bad shape, has cannot move very well, and then they inject it
mm,
directly with an injection into the egg. Yeah,
mm.
so that one can be helpful.
So, doctor, talking about cost and affordability,
Yes,
um, last time you said the cost when it comes to money fertility was a little high, but you said it was more important for someone actually to find out the cost, then they later plan for
yes.
like if they can afford. What is the case for women in terms of affordability and accessibility?
It is not specifically for women. I think for all couples. Yeah,
Mm,
Yes, it's expensive because health systems in low and middle income countries have not prioritized fertility
Mm,
as a division that they have to manage in the population.
mm,
Yes, they are thinking about malaria, tuberculosis, HIV, and
mm,
those infectious diseases.
mm,
And many insurances will not even offer eh, to cover
mm,
fertility treatment. Yet
mm,
remember, all these things they are using in these processes are imported with full tax from outside the countries.
mm,
So it still remains a cost, yes. But what I tried to share one time at a conference, the Fertility Society of Ghana, for
mm,
example, they have gone around to screen women who can conceive by the other method I told you of
mm,
IUI. So they are training people to a cadre of nurses, fertility nurses, to be able to
mm,
deliver that. So that is what is making it a little bit affordable for
mm,
them, their countries. But as we are now, like in Uganda, for example, yeah, it is still at a cost only if you go to a facility where the management can give you a discount. For
mm,
example, the cycle has failed, or if you demonstrate to them that you can't pay. Yeah, and that one is also a very hard road to climb because everyone will come and say, we cannot pay.
yeah. Mm,
Yeah,
mm,
so it is also very difficult to
mm,
prove out your case. Yes. But for now, as far as I know, from the biggest national referral hospital, an IVF cycle costs you not less than 15 millions. And that is from the government facility.
mm,
And in it, you have to depend on the success rate of the facility you have gone. So you go, you pay 15, you think you have saved. The private is telling you 19 millions, but your chances of succeeding in a private facility are higher than in the
mm,
government. Yeah. But the fact that infertility is not an emergency condition like cardiac arrest and respiratory failure, a person can always plan out how to handle it. Yes, we
mm,
can say, yes, I've discovered now, but I want to start intervention next year in July or in May or in August. Yeah,
mm.
so you can keep on saving your money. The money we are spending on buying new number plates of cars, on buying plots that have wrangles, can be used to have a child in your family. Yes.
Yeah. So, Doctor, lastly, let's talk
Mm,
about the Sally
mm,
Fertility University yet to be launched.
yes.
How is it? How
Mm,
will this help to bridge the gap between
mm,
because I think one of the things that we can talk about today is also lack of so
mm,
many trained cadres at different level when
yeah.
it comes to facility. It
Mm,
makes those that are a
mm,
few available overwhelmed, but maybe also become so expensive, like to get. So how is
mm,
Sali International Fertility University going to bridge this gap, and what should we
yes.
expect? And
Mm.
yes.
Yes, thank you. That is a very good question as I close. Yeah, just know that Dr. Sali was the first doctor in Uganda and in East
Mm,
Africa to
mm,
open up an IVF facility.
mm.
Okay? Yeah.
Yes.
People have been trying before, but they never had to succeed. And he came
Mm,
with a lot of expertise from the United Kingdom, from Kuwait, from Saudi Arabia. He said even in Saudi Arabia, he's the one who started the first clinic in that country. In
mm,
Kuwait, sorry. Yeah. So he has gone ahead. He wants to pass on his legacy to make sure that he opens up this institute. He's still going to
mm,
be the first one in East and
mm,
Central Africa to teach facility. Yeah,
mm,
otherwise people are traveling, going to India, which is very expensive to study, you know, and others
mm,
are learning on job. I don't know
mm.
if you have ever used border borders in Uganda. There is no time you ask a border rider and say, "Where's your riding permit?"
Yeah.
All you do is to sit on. Whether that person
Mm,
had an accident 2 hours ago, you sit on
mm,
his board and ride with him. So there are many health
mm,
workers who are doing these things, but they are not trained to do them. So
mm,
this school is called Sali International School of Fertility Medicine.
mm,
SISFM.sc.ug is the website.
mm,
Yeah, we have gone ahead into accrediting it and registering it. We're in the process of achieving a pre-license for the school.
mm,
Yesterday,
mm,
we had a team from National Council of Higher Education of Uganda.
mm,
I took them around through the facilities, and they were really convinced. So they are giving
mm,
us feedback in January that we
mm,
have enough facilities that can conduct these training courses. We have also partnered with another company called Study Medic. You can Google these companies online. They are
mm,
training people online in doing membership and professional exams for the United Kingdom, uh, training them to be licensed. Yeah, so we are partnered with them. So they are going to be teaching part of our education online while the
mm,
students come to our hospital and be trained to get the hands-on experience. So that is how SISFM is coming up, and it's going to address the need. I've had so many people ask, and so many people want to join as soon as they know that the courses are running. And I
mm,
can tell you that we're not going further than end of this year or early next year before this happens. So it is
oh,
a school that is going to help people to save
mm,
them the cost and the travel that they have to go through when they go to train in India. I left my family and went for training for a number of months, but it was not easy. It was not an easy decision. So you
mm,
can imagine that so many people want to learn, but they don't
mm.
have where to train from. And that's what we are doing now. Yes.
Okay, I thank you so much, Doctor, for that. And again, we pray and hope that the
Mm.
university will open very soon to give
Soon.
chance to
Mm.
more health professionals to get that skill that maybe
Mm.
at the end will try to lower down the costs involved
Mm.
in
Yes.
operating these specialized clinic. Thank you so
Yeah.
much, Doctor, and have
Yeah.
yourself a blessed
Mm.
day, and may God
Yes.
bless you.
Thank you very much. And